What is vasculitis? Inflammation of the vessels, ठीक है, due to any kind of immune compromise, ठीक है. Spasm of vessels, which is known as vasoconstriction, ठीक है, when the artery gets constricted from outside, not because of any kind of plaque formation, but when the artery gets constricted from extrinsically. So localized causes involves 3 levels. This is arterial, venous and microcirculation. Microcirculation means when it happens in our capillaries, meaning in our part of the skin. ठीक है, these are known as capillaries, microcapillaries. ठीक है. In arteries there is thrombosis, embolism, vasospasm, atherosclerosis, torsion. Torsion means when any organ or any blood vessels get twisted. ठीक है, it is known as torsion. Ligation means if in a surgery, when the surgeon has to cut a blood vessel, then he has to ligate it, which means tying it up. ठीक है. If the blood vessel get tied up, then it will stop moving and will start forming blood in the area and not able to pass the blood throughout the system. ठीक है. And tourniquet, as we already have studied in our blood collection, we use tourniquet for formation of to making the vein prominent. So if the tourniquet remains there for a longer period of time, it will start accumulating blood within that area. In venous condition, it is thrombosis, varicose veins and hematoma. Thrombosis, as you already know. Varicose veins means when due to gravity or there is pooling of blood. ठीक है. It happens in our veins. Veins have valves in them. ठीक है. So if the blood gets, if the valve is not able to close properly, so the blood gets pulled in a certain area. ठीक है. Then there will be deep vein thrombosis. ठीक है. It happens mainly in our lower limbs. Hematoma is when blood gets accumulated outside the blood vessel. ठीक है. Microcirculation, sickle cell anemia. Sickle cell anemia means when the RBCs gets in a sickle shaped and they form and they accumulate together with other RBCs, forming a clump. That clump may get lodged in any part and will start to obstruct the flow of blood. Fat embolism, which means lipids, which is also we already know as atherosclerosis due to lipid or cholesterol buildup. Vasculitis is the inflammation of the vessels. And bed sores. Bed sores are also known as pressure sores. ठीक है. In patients who have been bedridden for a long period of time or someone who is sitting, they can develop this kind of pressure ulcers. ठीक है. So this is the ischemia. ठीक है. After that we were going to discuss about the infarction. So what is infarction? It is the necrosis of a tissue that happens due to ischemia. Necrosis means death of a tissue. ठीक है. Necrosis means death of a tissue which happens due to ischemia. Is known as infarction, which is also known as hypoperfusion. ठीक है. These are the causes for hypoperfusion and this is a mnemonic T vector. ठीक है. So TE stands for thrombi and emboli. ठीक है. V stands for vasospasm, which means spasm of the constriction of the vessel. Expansion of atheroma. Atheroma means atherosclerosis, which means build up gradual. ठीक है. Then there is extrinsic compression of vessels, which means when the vessel get compressed by any extrinsic force, such as in BP cuff, when we increase the pressure and it gets it constricts our hand becomes numb, which means the blood flow gets restricted. So if it happens for a longer period of time, then this can turn into an ischemia and then infarction. Okay? And extrinsic compression can also occur in case of road traffic accidents, or if in an earthquake, if a slab of building falls on a limb and it gets trapped there, then it will make the flow of blood impossible to the other part of the body. Okay? Vessel twisting of the vessels. Okay? Traumatic vessel rupture, which happens in any kind of blunt trauma. Okay? So this is the main difference. This is the thrombus, which occurs in a same place, stays in the same place. But in emboli, it gets lodged to any part of the body or any part of the blood vessel. Okay? Emboli including blood clot or air gas. Another is septic infarct, which means septic vegetation, bacterial vegetation. When many bacteria come and join in a place, that place becomes a vegetation. That is known as vegetation. And that vegetation can get lodged throughout our body. Okay? This is the vasospasm. Is a condition in which an arterial spasm leads to vasoconstriction. This can lead to the tissue ischemia and tissue death necrosis. Okay? See, these are the RBCs which are flowing normally, but in vasoconstriction, when the vessel gets constricted, only a few amount of RBCs gets to move. Okay? Expansion of atheroma. This is the atherosclerosis, which is happening in both sides, which is obstructing the flow of RBCs. Okay? This is the extrinsic compression of vessels, which can be due to contracted skeletal muscle. Skeletal muscle means the muscles which we can voluntarily control. Okay? It is getting compressed, it is compressing the vein. Okay? That is why the vein is not able to flow properly, blood is not able to flow properly through the vein. Vessel rupture, which is due to trauma, hemorrhagic stroke. Okay? In a brain, such as in road traffic accidents, people get their head bashed into a structure and will cause rupture throughout the vessel, and blood will start moving out of the vessel and get formed in the brain. Okay? This is vessel twisting. These are the normal vessels, and this is how the twisting blood vessels will look like. This is the end result. It will happen in our lower extremities more. Okay? Examples such as patients who can develop this are traffic police who keep standing there for more than 10 to 12 hours. They can develop this, or any farmers which are standing on their feet and doing work all day by standing, they can develop deep vein thrombosis. Okay? What are the types of infarction? That is red infarction, which is also known as hemorrhagic infarction, white infarction, anemic infarction, and septic infarct. Okay? Red infarction, white is known as red infarction. Hemorrhagic matlab rupture, any kind of trauma, in which case blood gets spewed to the local organs. Okay? And blood, what does blood contains? RBCs. RBCs contains hemoglobin. Hemoglobin gives the red color appearance. That is why it is known as red infarct. Okay? In white infarct, in anemia, means if there is less amount of RBCs. Okay? and in septic infarct, which means sepsis. Okay. Red infarct with venous occlusions. Okay. In ovarian torsion, which means the ovary get twisted, and with it the other blood vessels which is there locally supplying the organ also get twisted, and that is why the blood flow to the organ gets limited, and gradually the ovary get necrosed. Okay. Then in loose tissue, for example lung, which allows blood to collect in the infarcted zone. Okay. Loose tissue, lung is a loose tissue in which blood gets infarcted in the infarcted zone. Okay. In tissue that are previously congested becomes sluggish because of sluggish venous outflow. ठीक है, जब venous का outflow कम हो जाता है, venous stasis जब हो जाता है, blood flow जब सही से नहीं होता है, ठीक है, this is when the red infarction occurs. And in tissues with dual circulation such as lung and small intestine. जैसे लंग में दो टाइप के सर्कुलेशंस होते हैं, वन इज ब्रोंकियल सर्कुलेशन एंड अदर इज पल्मोनरी सर्कुलेशन. ठीक है, तो इन दिस केस द इन्फार्क्शन हैपेंस बिकॉज इन such as in pulmonary condition the pulmonary arteries get blocked but the bronchial artery is still providing blood to that organ, but that blood is not enough. Okay, then it will start to develop the infarction. Okay. This is the white anemic infarct with arterial occlusion in solid organs with end-arterial circulation such as heart, spleen and kidney. Okay. We all know that heart has limited blood supply. There is no anastomosis, which means if one of the artery gets blocked, there is no another artery to provide blood on that particular muscle. Okay. And the supply of what are the blood supply for heart? It is coronary arteries, spleen, splenic arteries, kidney, renal arteries. So there is less amount of blood, which means less amount of RBCs, and so there is paleness. Okay. As you can see, there is pale color from the rest of the part. Okay. Because blood was not provided in this area, so it got pale in color. Okay. This is the septic infarct, which is bacteria containing emboli. Okay. As we all discussed, bacteria when they clump up together they form vegetation and they get lodged in any blood or blood vessel. Okay. This is the emboli that happen within the heart. This is the blood vessel. May form abscess and pus. Okay. Bacteria, what does bacteria does? They start to kill the cell one by one. Okay. As the cell gets deteriorated, the pus, the fluid within the cell get transformed into pus. Okay. So now what are the factors that influence the development of the infarct? Okay. What are the factors that can develop? What is first is the nature of vascular supply. Okay. Another is rate of development of occlusion. Okay. Vulnerability to hypoxia, oxygen content of the blood. So in this nature of vascular supply, as we all discussed, the availability of alternate blood supply is most important factor for determining whether the occlusion of the vessel will cause damage. ठीक है, जैसे लंग में one organ, if pulmonary artery gets blocked, the bronchial artery is still providing blood, so the infarction process will get reduced. If it will happen in 12 to 15 hours, normally if it occurs in 12 to 15 hours, in this case it will happen in 3 to 4 days. So the time period for infarction will get delayed due to another blood supply. Okay. Rate of development of occlusion. slowly developing occlusion are less likely to cause infarction because they provide time for development of alternative perfusion pathways. इसका मतलब जब जैसे कोरोनरी आर्टरी है, ठीक है, राइट एंड लेफ्ट कोरोनरी आर्टरी, लेफ्ट गेट डिवाइडेड इनटू टू मोर आर्टरी, व्हाट इज लेफ्ट एंटीरियर डिसेंडिंग एंड अदर इज लेफ्ट एंटीरियर circumflex artery. ठीक है, तो if the anterior descending gets blocked, then it will have time. Since the blockage will happen gradually, it won't happen within 1 or 2 days. It will happen for more than 2 to 3 months. ठीक है, so in that time another blood vessel can develop in that area, ठीक है, on its own, that will provide blood to the anterior part of the heart. ठीक है, so this is known as alternative perfusion pathway, which means it's creating its another blood vessel for better blood flow. But if you can see there, for example, the three major coronary arteries in the heart, if the coronary arteries are only slowly occluded, flow within the collateral circulation may increase, sufficiently prevent infarction. ठीक है, infarction जो होना चाहिए था 1-2 दिन में, वो डिले होके 4-5 दिन में होगा. ठीक है, बट infarction will still occur. The blood vessel will still not be able to supply properly. ठीक है, so even though the major artery is eventually gets occluded, ठीक है, eventually it will get occluded. Then there is vulnerability to hypoxia, susceptibility to hypoxia. Tissue of hypoxia influences likelihood of infarction. ठीक है, like neurons undergo irreversible damage when deprived of blood supply for only 3 to 4 minutes. ठीक है, अलग अलग ऑर्गन्स या फिर अलग अलग सेल्स के डिफरेंट क्राइटेरिया है, डिफरेंट कंडीशन है. लाइक द न्यूरॉन्स which are present in our brain, if they don't get blood for more than 3 to 4 minutes, they will start to die off. ठीक है, but myocardial cells, although hardier than neurons, are quite sensitive and die only after 20 to 30 minutes of ischemia. Means neurons 3 to 4 minutes में die off हो जाएंगे if they don't get oxygen or blood, but जो myocardial cells है which are present in our myocardium, ठीक है, हार्ट के 3 लेयर्स है, हार्ट मसल्स के, एक है एंडोकार्डियम विच इज़ द इनरमोस्ट, मायोकार्डियम, फिर एपिकार्डियम. ठीक है, तो मायोकार्डियम हैज़ कॉन्ट्रैक्टल क्वालिटी. ठीक है, तो मायोकार्डियल में जो सेल्स है दैट विल डाई विद आफ्टर लाइक 20 to 40 minutes. So if a person is having myocardial infarction or angina, they can still be cured if they are brought to the hospital within 20 minutes. ठीक है. In contrast, fibroblast within the myocardium remains viable even after many hours of ischemia. अब fibroblast क्या होता है? What are fibroblast? Fibrin forming cells. Mainly they form collagen. ठीक है, and cellular matrix. ठीक है, तो these cells can remain active even after 1 or many hours of ischemia. So the vulnerability to hypoxia, first the cells which are very much sensitive are the neurons. ठीक है, then the myocardial cells and then the fibroblast. ठीक है, so if any damage happens, if the brain doesn't get enough blood within 3 to 4 minutes, it will form very irreversible damage. ठीक है, the brain controls everything in our body, like the breathing centers, vomiting centers, everything is controlled with the help of our brain. So if the necrosis happens, it will create a irreversible damage to that brain and the person might be disabled forever. ठीक है. Oxygen content of blood. Partial pressure of oxygen in the blood also determines the outcome of vascular occlusion. Partial pressure of oxygen, which जैसे हम ब्लड गैस ये करते हैं, ठीक है, आर्टेरियल ब्लड गैस जब हम लेते हैं डायरेक्टली फ्रॉम आवर arteries, then we can see the partial pressure of oxygen, partial pressure of carbon dioxide. So the partial pressure of oxygen from our artery should be around 75 to 100 mmHg, which means the oxygen that is in our blood is putting pressure. Okay, the blood is also, oxygen is also putting pressure. The pressure should be around 75 to 100 mmHg. In carbon dioxide, it is 35 to 45. Okay? If the partial pressure of oxygen decreases, then it will start getting infarcted. Okay? Ischemia will happen. The infarct of different organs. Myocardial infarction, since there is less amount of blood supply, it will become pale. Okay? Such as end arteries, end organ arteries. Okay? Heart is an end organ artery, it will become pale. Outcome is frequently lethal. People may die. Okay? Pulmonary infarction, hemorrhagic. Okay? Because there is alternative blood supply, which means if one blood gets occluded, another blood supply will be there, and the occluded blood will start accumulating within the loose tissues. Okay? So it becomes hemorrhagic because there is increased amount of blood within it, and hemorrhagic because it has RBCs. Cerebral infarct, it can be hemorrhagic or pale. Cerebral infarct can be hemorrhagic or pale. Okay? Fatal if massive. Other organs may infarct such as kidney, intestine, spleen, liver and lower extremities. These are the other organs. What is myocardial infarction? The most important consequence of coronary artery disease. Okay? Patient may die within few hours of onset. Okay? Incidence occurs in all age but more commonly in elderly. So myocardial infarction occurs due to plaque formation within the coronary arteries. Okay? Plaque with acute clot in the coronary artery blocking blood flow and oxygen to the heart. Okay? This is the main cause for which myocardial infarction will happen. Pulmonary infarction. Pulmonary infarction due to thromboembolism. Thromboembolism, which as we all know, embolism क्या होता है? What is embolism? Movable clot या फिर movable thrombus. ठीक है? It gets lodged to the pulmonary artery and gradually there will be an infarct. ठीक है? As we can see, this is a lung and the black area is air, and here it is getting little bit less black, which means necrosis is happening in this part, so it is getting solidified gradually. Okay? Cerebral infarction, non-occlusive, may caused by compression of cerebral arteries from outside during hernia. hernia पता है क्या है? ठीक है, ए स्मॉल ओपनिंग से जब कोई टिश्यू या फिर ऑर्गन निकल जाता है तो सारा जितना सारा भी ब्लड फ्लो होता है सबका एक अलग रूट है. अगर दूसरा कोई ऑर्गन आके उधर जमा हो जाएगा तो इट विल पुट प्रेशर ऑन द आर्टरीज. ठीक है, एंड दैट इज हाउ cerebral infarction can occur. Occlusion due to artery occlusion or venous occlusion. ठीक है, this is because of herniation. This is because of artery occlusion. This is the CT scan of the brain. See here, it can be due to cholesterol, which is atherosclerosis, or can be due to thrombus. ठीक है, getting lodged within the cerebral artery, and if get lodged, it will become, the area will get less amount of blood. ठीक है, and gradually it will become darker in color. ठीक है, समझ में आया?